Hello, hello, hello. Welcome back. I'm Alessandra Nicholson, CRCST and owner of the Candray Institute. We are on session 2 of our 4-week series, Ready, Set, Sterilize. I am holding this space for study hall for all of my former students that are self-studying and getting prepared to take the CRCST exam. So we are Last week we did our first session of study hall. We met for about an hour 15 minutes, and we went over just the first few chapters of basic foundations of all that is sterile processing. So today we're going to go a little bit deeper and get into decontamination. I'm also going to review some vocabulary words with you guys, and hopefully, fingers crossed, we'll have someone from the class come up and share their flashcards today so that we can get an idea of what that should look like when we're preparing them for ourselves. So just a real quick recap. When the Hillman Talk trend happened during February and during Black History Month on TikTok, I made a post asking if anyone was interested in free sterile processing education. And of course, that video went viral because people are looking for free education. People are looking for opportunities to get jobs. So we hosted a class, and that finished in about mid-April. And so we did our first one last week. For the next 3 weeks, I'll be doing study hall sessions. So I have my notes all ready to go. So this will be recorded for y'all. Of course, if you're a Candray Institute student, you know that all of the reruns will be in the live section. So all you need to do is head over to the YouTube, check in with the live section, and you'll find the video there. Okay? All right, so let me pull up the notes, and then we're going to get started for today. The nice thing about preparing for the CRCST exam or the CBSPD exam, whichever one you're getting ready to take, is that it is very much vocabulary heavy. So if you've got those flashcards and you're studying them on a daily basis, you should do well. You should do fairly well on that exam. And then what I hope to drive home during study hall sessions for my self-studiers is the basic concepts of sterile processing, because once you get those foundational concepts about decontam, assembly, sterilization, and prep or sterile storage, you're able to then think through the questions that show up for you on the exam. Okay, so you don't have to be a subject matter expert about every single thing in your textbook, but you do want to have a strong grasp on the information that they're covering on that exam, which are your big areas, your decontam, your assembly and prep, which includes your instrument inspection and identification, your sterilization, and then your sterile storage. They're also going to get into distribution, which is what happens to the surgical instruments once they're sterile and the OR calls you and they tell you that they need it. That's what we call distribution. Okay, so I've got my PDF up here. Let me share my screen and then we'll get started. And everywhere in my notes today that you guys see anything about a game or a Kahoot, know that that's for my regular class. So I don't have those links available to the free students. What I would suggest is anywhere on my notes today that you see Kahoot or some type of game, utilize that time to study your vocabulary flashcards, okay? I know y'all are probably sick of me saying that because I probably say it at least 3 times a session that I meet with y'all since February, right? But I really cannot stress it enough. I even shared a video on TikTok today of a young lady that said, "How did I pass my CRCST exam?" These flashcards that she made. Also, let me be clear. There are many products that you can go out and buy, okay? There's many, like you can go and get you a subscription to Quizlet. There's anatomy and physiology ones. There's medical instrumentation ones. Like even for my students, I provide medical instrumentation flashcards for my students. Now, that being said, in my personal opinion, nothing, and I do mean nothing, tops you making flashcards for yourself by hand as you go through, or typing on the computer, however you feel comfortable, as you go through the book. And you're able to see those terms, those key terms, and then make a flashcard for it, okay? And then carry those around with you and utilize them in your downtime. Okay, so ready, set, sterilize, the TCI Study Hall Series. We're on session 2. I'm going to pop my notes up on the screen. We're going to get started for today. Ooh, baby, I love your way every day. Oh, so I thought I could just share my screen. And I can. And I can. Oh, I'm being technically challenged at this time. Hold, please. One of the lovely things I'll say about being a millennial is being able to navigate all this tech. But there are even days for me where I'm like, what? And what? And what did you want me to do? You want me to click on the what? What's going on? Here we go. All right. Now I can share my notes. Okay, let me click on that. Try that again, as they say. All right, here we go. Okay, so you should be able to see my notes if you're over on YouTube. Hey, over there on TikTok, if y'all want to see the screen, click on the link in the bio and head over to the YouTube. Okay, so today we're doing session 2. I chose to cover chapters 6, 5, and 8. We're going to be taking a look at surgical instruments, high-level disinfection, and prep and pack. So getting a little bit more into the surgical instruments themselves. We did a high-level overview of all the areas last week, which included the decontam that I was talking about earlier. Okay, and then I also wanted to, just because I saw somebody just popped in, I want to say again, as I go through my notes, anywhere that you see where it says a Kahoot game or like flashcards, anything like that, that's for you to utilize the flashcards that you have made for yourself from your reading, okay? Those other links are links I have that are inside of the paid program. So you won't see those on the website or on the on the YouTube page. Okay, so I'm trying to figure out what the best way is for me to have both you guys and my notes up on the screen. So bear with me, like it's my first day at the rodeo, child. Okay. I feel like that makes it smaller for y'all. So what I'm gonna do is go full screen on those notes, and then I'll come back and check in for comments, okay? If you have questions from your own study or your own reading that you've been doing, do not hesitate to ask, okay? Because this is you guys' a study session. So if there's anything in particular you want to know about, you either let me know. Okay, so the Candray Institute, we are doing a study hall series. We're on session 2. Today, we're going to be taking a look at instrumentation, prep, and packaging. All right, so our focus areas, like I said earlier, are going to be chapters 5, 6, and 8, looking at surgical instrumentation, high-level disinfection, and prep and pack. All right, so one of the things that I had on my notes was just a quick little icebreaker to ask, what's one instrument or tool you've seen but you don't know the name of? And what I realized when I was typing it out was y'all haven't really touched surgical instruments yet. So that won't necessarily be super helpful for you. So what I would say to you guys as you get ready for the exam is to spend time in that surgical instrument section. And I especially want you to pay attention to how you check the instruments for what we call workability, okay? And your textbook is going to call it workability. And what workability means is if I have a pair of scissors, do they cut? If they don't, they're not workable. Does that make sense? If I have a kerosene rongeur and the point of it is to punch a hole in bone, and I try to use it to test it and see if it'll cut through a piece of card, and it won't cut, that instrument has no workability, okay? No workability. All right, so I want you guys to have a strong grasp on the surgical instrumentation, the basic ones, the scissors, the needle holders, the chisels, the rongeurs. And when I say those terms to you, even if you can't necessarily recognize them if I was to lay them out on a table, when I say those terms to you, I want you to have a flashcard about how do I check this instrument and make sure that it works for my surgeon, okay? Because there's no point in us spending our time cleaning and sterilizing instruments and getting them all ready to go up to the OR only to find out that the scissor don't cut, the rongeur don't punch, the chisel don't chisel. It ain't shaving off nothing. It's dull and it's got punches all over it. It's rusted out and we can't use it, right? So when we're in that prep and pack area, that's where we're checking those things. We want to make sure that things are cutting, things are grasping, things are retracting. Whatever the job of that instrument is, it's functioning, okay? We're also checking to make sure that it's clean. So first we was making sure, well, really first we should make sure it's clean. Let me rearrange that thought in my mind. We should first check it and make sure it's clean, because if it's not clean, it's not safe for you to handle it. It's not safe for your patient. So it goes back to decontam automatically, right? So I'm at assembly. I checked my surgical instruments. I know now that they're clean, they're free of bioburden. Next, I want to check them for workability. If it's a scissor, does it cut? If it's a clamp, does it grasp? If it's a book washer, does it retract? If it's a kerosene, does it punch? Okay? I want to make sure it works. Then I want you guys to check those instruments and make sure that they're safe to use. Now, what do I mean when I say that? Because Alessandra, you said it's already clean. We checked it for cleanliness, it's clean. We checked it for workability. It does what it says it's supposed to do. What you mean is it's safe to use? Well, there might be things like rust that are happening, right? So we want to make sure we don't see rust. We want to make sure we don't see pitting or any type of holes or gouges that are coming into that stainless steel. Okay, we want to make sure that if there's any type of instrument tape on there that's color coded for identification, that it's in good condition. It's not dried out. It's not looking like it just went through a desert dust bowl. It ain't all crinkled up on the edges because it's lost every piece of moisture inside of it, okay? We want to make sure that the instrument is safe, because let's say we had that surgical instrument tape on our instrument during assembly. Now, we checked it for cleanliness. We checked it for workability, but we left that dried up, crinkly, old, dusty instrument tape on there. What could potentially happen to our patients? When we're using it, hey, friend. And if y'all want to see the notes, head over to the YouTube, okay? I'm live on YouTube too. If I leave that surgical instrument tape on there and let's say it chips off, y'all know how y'all get y'all nails done and that polish be old and it start to crinkle and crack on the edges, it start to flake off? Your instrument tape can do the same thing. Would you want that flaking off inside of your body cavity? I don't want that. So that's what I mean by safe. Is it free of rust? Is the surgical instrument tape in good condition? Is the instrument's passivization layer, is it fully coated, or do I see places where there's rust and there's pitting? If I do see those things in assembly, let's say it's not clean or it's not working properly or it's not in a safe condition, then I'm not going to put that surgical instrument in my tray, okay? I'm going to pop these notes down and come check on y'all YouTube. Okay, y'all good. Okay, so let me pop back up. Hopefully that makes sense. If you have questions about it, don't hesitate, just ask. All right. And then key instrument names with visual aids. I want you guys to, in your textbook, like I said, spend time reviewing those surgical instruments so that you can identify them. There are several what we call basic surgical instruments. And when we say basic, we don't mean that they're not complex or they don't require special attention when cleaning or anything like that. We just mean that these are tools that you're going to see in almost every single type of surgical set, right? So whether it's orthopedics, open heart surgery, vascular surgery, pediatrics, urinary, don't matter. There's certain instruments, we're going to see them everywhere because they have a basic function. The scissors that are cutting, they're clamps that are cutting off arteries. Okay, they're retractors that are keeping body cavities open. So I want you to have a clear view of those things. Some of the ones that I've named already today, just like your scissors, your rongeurs, your kerrisons, your chisels, those are all things that you guys should be able to visually recognize. And like I said earlier, even if you can't point it out in a lineup, when you hear the term, you should be able to tell me how to clean it and how to check it for workability. Okay? That will be on your test in some form or fashion. They're going to ask you, how do you make sure scissors are sharp, or how do you make sure that they can be cut? What surgical instrument inspection step do you complete in assembly to make sure your rongeurs are working? It's going to ask you something. Okay. All right. The last thing I'm a little bit over. A last thing I want to remind you guys about when you are going over Chapter 6 of the HSPA CRCST Technical Manual. I want you to be able to do a quick recall practice on name that instrument, okay? So you can just take, now this is old school. Okay, so if you don't want to do this, don't do this. But this is something I used to do when I was a kid. And I think it's helpful, especially because I everything in this class that I offered on TikTok was free. So like I said, if you guys were in my paid class, one of the materials that you get is surgical instrument flashcards, but y'all don't have that. And that's okay. You ain't got to go broke becoming a CRCST. Take your textbook and draw outlines of the surgical instruments, those main ones that I was talking about, and use those for your flashcards. It's just to give you a visual, okay? I don't want you in there trying to be Picasso. You ain't got to draw it to something so great that we hang it up in the art museum, all right? Just a basic outline so that so you can recall it and it's familiar to you, okay? The big leadership skill focus here is attention to detail and pattern recognition. Because when you go in to take this test, you're going to have 100-some questions. And a lot of the answers to some of these questions are going to be on the test if you're paying attention and you have been practicing these basic fundamentals at home. All right. And don't forget, of course, we're on session 2 of Ready, Set, Sterilize, the study hall sessions. I'm doing four of these for you guys. All the reruns are on YouTube in the live section. So even if you miss something from this, you can come back and watch it. Also, the class that I taught for free for Hillman Talk is still on YouTube. It's still there. I haven't taken it down yet. So you still have time to buy a book and self-study if you want to. Okay, so let me double check on my YouTube, see if I see any questions. Otherwise, we're going to get right into the next section. Y'all chilling? Y'all chilling. All right. Again, if you have questions, pop them up on the screen. This is your study hall session. If there's something that you don't see on the notes you want to ask about, feel free. Okay, this is just what I have prepared for you. Okay, so next, looking at Chapter 5. Key things I want y'all to pay attention to in Chapter 5. A lot of people get tripped up on the Spalding classification system. Okay? A lot of people get tripped up on the Spalding classification system. Reason being, it's a little bit confusing. It's a little bit confusing, but it's very important. So if you don't have a flashcard for the Spalding classification system yet, make that because you're going to need it, okay? You're absolutely going to need it. Okay, so when we look at the Spalding classification, what it's telling us is what type of sterilization level our surgical instruments have to be at. And I know that might sound weird if you're coming from it from outside of the surgical department, because you might be thinking, wait a minute, if I'm having surgery, doesn't that mean everything got to be 100% clean? But the answer is no. And let me tell you why. Certain parts of the body are what we consider dirty, right? So, and I always tell y'all, I don't want to be nasty as I come at y'all or whatever. But we're talking about the body and we're talking about surgery. So we're going to talk about the body and we're going to talk about surgery. Okay, so buckle up, put your big kid pants on. The Spalding classification is going to break down parts of the body, and they're going to give it terminology that gives you as a technician the knowledge that you need to know what level of sterilization you need to hit. Now, in the world of sterilization, if we were to have it be a step ladder, at the bottom of that step ladder is going to be what we call high-level disinfection. And it's just what it sounds like. It is a disinfectant chemical that is used that kills the germs like a bleach will kill germs. But what do we know about that? Bleach it's not going to kill every single thing on the surface and keep it that way forever. Okay? It don't work like that. So that would be something that we call high-level disinfection. Then when we start using the term sterilization means I have killed every bug, germ, spore available on this instrument. Nothing remains alive on this instrument. Okay, so you can see there's a slight difference between something that is high-level disinfected and something that is sterilized. Okay, so now staying in that high-level disinfection area. Within high-level disinfection, there are levels, okay? So that's what this Spalding classification is going to break down for y'all. Level 1, for my notes, is critical items. And I say for my notes because there is no real level 1, 2, 3. I'm just utilizing this idea of a ladder to give you an example of how this works, okay? So let me start at the bottom. Non-critical items, okay? These are going to be instruments that are defined as devices that touch intact skin only. Intact skin only. What does that mean? That means we're talking about a stethoscope that they're going to put on the outside of my intact skin. There's no cuts. There's no openings. There's nothing that is wrong or broken or off about the skin here, right? It is completely intact. So we have some medical devices like a stethoscope or a blood pressure cuff that are going to come in contact with intact skin. And those are what we call non-critical devices. They don't have to be sterilized, but they do need to be disinfected, right, between patients, but they don't have to be sterilized, with sterilizing meaning that there are 0% germs, bugs, or spores available on this instrument. So in the Spalding classification, when I have a device or an instrument that is called non-critical, it's going to mean that it requires a low to intermediate level disinfection. A low to intermediate level disinfection. What is that? That's going to look like something like when you guys have like a Sani wipe or a bleach wipe and you wipe your table down. It's going to kill the good majority of the stuff that's on there. And that's what we call a low-level disinfection. But it is not sterilization because it is not killing every single thing on the surface and keeping it that way, okay? So non-critical devices require low to intermediate level disinfection. That's going to be your blood pressure cuffs, your stethoscopes, your bedpans, okay? And oftentimes when we're talking about sterile processing, non-critical items will be cleaned at the point of use by the department that owns them. For instance, there's not a big collection of stethoscopes that get sent down to the sterile processing department for me to wipe them down and then send them back. They're going to do that at their bedside. They're going to get an alcohol wipe. They're going to get a cavi wipe. They're going to wipe down their non-critical devices, their stethoscopes, their blood pressure cuffs, and they're going to keep them in their departments, okay? So you're going to need to know that for your exam, but you won't necessarily be doing that work in your field, okay? So that's non-critical devices within the Spalding classification. The next one we have is semi-critical devices. Semi-critical devices are those that come in contact with mucous membranes or non-intact skin. Now, what does that mean? Where are you going to find a mucous membrane on the body? One of them might be, I have to push something down your throat. One of them might be, I need to stick something up your nose, take a look. I'm going to come in contact with mucous membranes. Once I come in contact with fluid inside of your body, any germs I have on my device can be moved right into your fluids and then moved all over your body, Okay, so there is more risk involved here than with the non-critical devices where we're touching non-intact skin, right? But not necessarily the same level of risk as if you had a big old cut on the side of your face and then I start putting non-sterile instruments inside of it. Okay, so some examples of semi-critical devices are going to be your endoscopes, your flexible scopes, your respiratory therapy equipment, your laryngoscopes. Those are going to be the big ones that you guys see. If you're making a flashcard for the Spalding classification system, I would highly suggest that when you write, like, so for instance, non-critical devices, those are devices that do not touch, or excuse me, that only come in contact with intact skin. I would write the examples of blood pressure cuff, stethoscope, because it's going to help you remember which one goes where, okay? Then with semi-critical devices, it's going to be your endoscopes. In your textbooks, you guys also see that called your flexible scopes. Okay, so these are going to be the ones that they put down your throat or they move up your anus. They're coming in contact with your mucous membranes. They need to be clean and they have to be high-level disinfected, okay? So when we look at the required processing for Spalding classification in semi-critical, we had that low level, which was something that we wiped down with like a cavi wipe or alcohol wipe. Now we're into semi-critical. I actually have to start using chemicals to start killing some of these bugs. Okay, because let's think about it. They put that laryngoscope down your throat. I cannot just wipe that down with a cavi wipe or with a bleach wipe and say, oh, it's good to go. No, I got to take that to Decatam. I got to push brushes through there. I got to flush it out. I got to do a lot more work. And then I'm going to take it to an area and do high-level disinfection. So high-level disinfection, you guys are going to find that in your sterilization chapters. I'm not going all over it. If you need me to go back over it, you're going to have to go get that video from the class, okay? But with high-level disinfection, we know that's our chemical sterilants, right? And the point of high-level disinfection is to kill all the microorganisms except high numbers of bacterial spores, okay? Semi-critical high-level disinfection will not kill everything, and that is the point, okay? That is the difference between non-critical and semi-critical and then critical devices. Okay, so now, we looked at non-critical, we looked at semi-critical. Let's talk about critical devices. Critical devices are going to be the ones that actually enter your sterile body areas or your vascular system, okay? I want you to know that those are two different parameters and they both matter. So sterile body cavities and or your vascular system. Some examples of this are going to be your surgical instruments, right? So those scissors, the knife blades, the implants, catheters, book Walter retractors, kerosene rongers, anything that you use to perform surgery in an open cavity, right? So let's say I got to open your chest. We are now in critical item territory. Everything going forward has to be sterilized. Can't be low-level disinfected. Can't be high-level disinfected. Must be sterilized. With sterilization meaning that we have killed everything. Every germ, every bacteria, every spore, all the microbes are dead. All right? So, just to recap that, and then I'm going to move on to the next section. Spalding classification system lets you know what level of instrumentation you're dealing with based on how that instrumentation is introduced to the body. Non-critical instruments are introduced to intact skin. Stethoscope goes on the outside and checks you. No cuts. It ain't going in nothing. Non-critical. All that needs is to be low level or intermediate level disinfected. That's going to be a cavi wipe or wipe down. Okay? Semi-critical devices, those are going to be the ones that come in contact with the mucous membranes. Anything going down your throat or going up your anus. I hate to be that person, but we talking about surgery. Okay, so we'll talk about surgery. Anything like that has to be high-level disinfected. That's going to be a chemical sterilization. Or excuse me. See how I did it? I just slipped up. I said chemical sterilization. That's not right. Because sterilization means everything is dead. And high-level disinfection is not everything dead. It's a high-level disinfection. Chemical disinfection. And then the last one was critical items. Critical items are the items that are going into your sterile body cavities or your vascular systems. That's basically all your surgical instruments. And those absolutely have to be sterile, free of microbes. Okay? Highly, highly suggest you have a flashcard for the Spalding classification system. Okay, so really quick, when we look at that low level and that high level disinfection, I talked about bleach, right? I talked about alcohol for my low level. For my high level disinfection, that's that glutaraldehyde, the OPAs, the hydrogen peroxides. You should have flashcards for those because those were terms in your book, okay? And then lastly, hold on, pull these notes back up. Lastly, for that section, when we look at the workflows for central service or for sterile processing, when it comes to high-level disinfection, it's going to follow the same workflow as all of your other surgical instrumentation, with the only exception being where it goes for disinfection. Now, what do I mean by that? One of the key things I want y'all to remember about your sterile processing department is that all of your instruments are on the same workflow. They never go backwards, only forward through their workflow. They start off clean and sterilized, sitting somewhere on a shelf. Then they go to the OR procedure room and they get used. Then they go to a soil utility room or a case card waiting for you. Then they go to decontam, and that's when we get our party started, okay? So now we're in decontam and we're cleaning our instruments. And when we get them free of bioburden, there's no bone, tissue, blood, film, mucus left. We take them to assembly. In assembly, that's where we're doing inspection. We're checking the instruments for workability. We're checking the instruments to make sure we have all the right things we need for this instrument tray. We're checking these instruments to see if they're safe to use. Are they rusted? Are they pitted? Do they cut? Do they have tape on them? Are they good to go? Once we get that done, we get them packed up for sterilization. They move on to sterilization, whether that's low temp or high temp. They get sterilized, and then they go right back on that shelf in sterile storage, waiting for a procedure, and that's the way they go. So we talked about this a little bit last week, or I think that was coaching session. Let me not get mixed up. Y'all didn't hear this. I asked them, if I'm coming to you as a nurse from the operating room and I have a tray that I opened in the operating room, but my patient wasn't in there and I didn't use it, and you're down in assembly and I bring you my tray, where does that tray need to go? What y'all got, TikTok? Where does that tray need to go now? It was on the shelf. She took it to the room. She opened it. Wasn't no patient in there. She didn't use it. She brought it back down to assembly and she said, hey, I got this tray. I don't know what to do with it. Where do you tell her that it goes? Anybody? Look, cricket, anybody? Where does it go? Bing, bing, bing. Come on, friend. It goes to decontam. It goes right back to decontam. It doesn't have to be grossly soiled in order for it to be dirty. And we know that because we spent time studying as sterile processing technicians. Thank you, Sherry. It goes to decontam. Okay? You don't have to, this is not a rocket science test, y'all. Once you get the basics of how instruments flow, you know. So then if I come to you and I say in decontam, I'm standing at your door and I have a sterile package, and I'm looking at you and I'm going, where am I supposed to put this at? Where's it supposed to go? It has to go back to sterile storage. And that's going to depend, right? Because you and I now both know if they bring my instrument tray, my clean, beautiful, sterile instrument tray, and they bring it in the decontam room, and they ask me, where does it go? Now what I got to do? If I'm acting right, I got to reprocess that tray. It could be compromised at this point. I have to reprocess that tray. So I want you to always be thinking about that life cycle of a tray, okay? It starts out clean, but once that sterile packaging is compromised, decontam, assembly, sterilization, prep and pack, hold, okay? That's it. That's all we got. All right, let me get off my soapbox on that and get into the next section. Okay, so the leadership skill focus with that, I want you guys making informed decisions based on the risk classification, okay? What are the tips for HLD and sterilization? That's a great question. So I can tell you right off the top of my head, 275 is going to be your temp and above for high level disinfection. Your temps for low level disinfection are going to depend on your chemical that you're using. So those I can't give to you straight out. It's going to be different for OPA versus glutaraldehyde versus alcohol and all that fun stuff. Now, that being said, where do you guys find that information on the floor? You're standing in decontam. You got let's say you got glutaraldehyde on your table and you don't know what temperature it's supposed to be at. Where do you find that information as a sterile processing tech on the floor? Anybody. Scream. What you got, Sherry? Where y'all get that from? You're on the floor. You can't call Alessandra. You done already passed your test. You done already got your job. Come on, Sherry. I knew you had it. I knew Sherry had it. Your IFU. Your instructions for use. Come on, TikTok. Come on. Your IFU. Your instruction use. That's where you're going to find that information. Okay? That's also why I tell you guys, it's not just this test. You're learning a mindset that you're going to use on the floor every day of your life for the rest of your natural life as a tech. Okay? This is not one of them classes where you're just going to learn all this stuff and then never think about it again. No. No. This ain't that. You're going to use that information. So you're going to be in decontam and you're going to go, damn, I don't know the temp for this. Okay, let me go grab my IFU. And start looking for that decontam room section and start seeing what is that temp? What's that humidity? How many times do I have to exchange this? How long can I use this? Some of your chemical sterilists you'll be able to keep for up to a week, some of them up to 30 days. It just depends on which one it is and what that IFU says. Okay, I don't want to hear nothing about no Candray Institute students standing up in the decontam talking about, Alessandra said it's 58 degrees. No, she said, check your IFU. All right. I'm okay. So leadership skill focus, making informed decisions based on risk classification, because that Spalding classification is telling you guys if it's a non-critical, non-critical, semi-critical, or critical device. Okay. Now, taking a look at chapter 8, couple of things I had up there. Do I sell, I had a question on TikTok that said, do I sell physical flashcards? No, I don't. I do have some recommendations for medical instrument flashcards if you want to buy those just for you guys to start to recognize instruments. But I don't currently sell flashcards. And let me tell you why I probably never will. One, if you really don't want to make your own flashcards, Quizlet exists. It's been out there for 1,000 years. I promise you somebody has flashcards up there for you to buy. I'm not going to recreate that wheel. I ain't got time. Okay. But two, the reason why I probably never will is because I genuinely think that it is in your best interest to make your own flashcards as you read. And what I tell my students is as you're going through the book, anytime you see one of them keywords in that little key term box, make a flashcard. Okay. Make one of those. Because those terms are going to show up on your test. And the thing about the flashcards is you take them with you wherever you go. Okay. So I have some coaching clients right now. They go to work during the day. Okay. They don't got time to be in class. They have a job to do. And when they get home, they look over their flashcards and they watch the videos. And that's how they stay up to date on the class. Your flashcards you can take with you anywhere. You can even hand them to somebody else and have them quiz you. It's just a very useful tool. And because you're spending the time to write it down and read those definitions, it's what we call kinetic learning. You doing that physically is going to help you remember it. It's going to help you make a memory about it, okay? All right. So looking at the prep and pack section, some key things I want you guys to take a look at in that chapter is the types of packaging, whether that's a wrap, a pouch, or a rigid container. Because when we're in the assembly area, There are multiple types of ways that we can get an instrument ready to go into the sterilizer. We can wrap it in a woven wrap. We can put it into a pill pack or a pouch, or we can put it into a rigid container. And those rigid containers also mean that we have to add filters and we have to add locks, right? So each one has different things that it needs you to pay attention to. In the instrument inspection process, I talked about this earlier in class. I'm not going to belabor it. When you get that instrument to your table, you're checking it first to make sure that it's clean. Because if it's not clean, that means it's not safe for you to handle, and it needs to go back to decontam. Okay, so I'm looking at my scissors and my lock boxes and my needle holders and my rongers, and I'm checking to see if there's leftover blood, bone, tissue, anything that needs to go back to decontam. Okay. Once I know it's safe to handle, the next thing I want to test is its functionality, or what we talked about earlier was workability. Does it work? If it's a scissor, does it cut? Or is it rigged? Does it have snags on it? If it's a rondeur, does it punch through a card? Or does it have a lot of little, is it getting kind of rippy? I don't know. It's not giving me a clean cut. Because the thing to remember about that stuff, guys, if the surgical instrument doesn't work for you down in sterile processing, what do you think it's going to do when it's in connection to somebody's tissue? Okay. If I have scissors and I'm using a exercise band to test them and I'm getting rigid cuts, what do you think that's going to do to the body? We're having surgery to repair. We don't be making more damage. Okay. So I'm checking them to make sure that they align. Do they approximate? It's another way you hear that in your book. So like say I have a scissor or a rondeur or a clamp that's supposed to meet the tips like this, but when I'm in the department, the tips don't touch. They go like this. That's failed on the functionality test. That doesn't work. That's get out of that tray. You either need to get a replacement or you need to let them know on the outside of the tray that does not work. Okay. The other thing in here is you're going to have a visual checklist I put on screen because most of you guys are going to have what we call instrument tracking systems. But even if it's just a printed paper, you're going to have a checklist of everything that is supposed to go into that tray. You need to make sure that you have everything in there. And if you don't, that you have made a note. Oh, hold on. I don't know what this thing on TikTok trying to say to me. Okay. All right. You have made a note about that. Okay. All right. So with the leadership focus in that area, process accuracy and process accuracy and documentation awareness. Because when you're in prep and pack, you're the one that is checking to make sure that the surgeon is going to have all of the clamps they said they need, scissors they said they need, towel clamps they said they need. You're the one that's going to be there for that accuracy. And then you're going to package it up and wrap it or put it into a rigid container that nobody else, we can't see through that. So we're counting on your documentation accuracy at that point. Counting on you. That's why I keep belaboring. If there's something missing, it's on you to explain what that is at that point, because your surgical tech, your circulator nurse, your surgeon, they all can't see that after you put it in the pack. Okay? All right, so these are my class notes, so you guys won't have access to the Kahoot, so I'm going to skip past that. And like I said in the beginning of the class, if you come in late, anywhere on my notes that you say that you see the games, utilize that as a time for you to study your flashcards, okay? Also, if you were here last week, I shared a bunch of free resources for you guys where you can make accounts with our third-party vendors and go and like some of them have games on there. They have videos, webinars you can watch. One of them is from HealthMark. And it's called Crazy for Clean. So if you're the type of person that likes little games to help keep you interested in your studying, use that. Okay. I'll put HealthMark up on the, hold on, let me look them up. I'll put HealthMark up on the screen so you guys can see the website. It's called HealthMark University, I believe. HealthMark Academy. All right, let me pop that up for you guys. Let me come back over to the StreamYard. And I'll show you that. And like I said, this is a website. Now, HealthMark in the industry, they do sterile processing education. They also sell sterile processing products like decontam brushes, gloves and gowns. and they've been in the industry for a very long time. Which one you asking, babe? You asking if I'm on Google or YouTube, or are you asking about HealthMark? But say right now I'm live on YouTube if you're trying to see my screen, but what I'm showing them. Okay, so here's the HealthMark website, Academy. It's a HealthMark Academy. If you just Google HealthMark Academy, you'll find it. HealthMark Academy. You can make a free account on there. They are now offering a prep course for CRCST, but it's not free like the one I have on YouTube right now. You're very welcome, friend. But what I want you to pay attention to is they have what they call CE approved learning. That's continuing education that you're required to get as a sterile processing tech. Every year we have to turn in 12 hours of continuing education. But the nice thing for you guys is you can use that to study to get ready for your exam. Okay. Also, they have down here, they have what they call Crazy for Clean games. And again, these are study materials you can use that are going to reinforce the key areas of sterilization, decontamination, sterile storage, instrument inspection. They're going to have a little bit of everything in there for you. Okay, so those are some tools you can use. They have old webinars that are in here. They have a podcast. So again, stuff that you can let just be playing in the background when you're going. And then lastly, they have product tutorials. And the product tutorials are helpful for y'all if you're not on the floor in the hospital, because it gives you a visual of what it looks like to be in decontam or to be in sterilization. Okay, something that again is just going to help drive home what that life cycle of a tray is, where it's in sterile storage and it's dirty at the procedure site, comes to decontam, goes to assembly and inspection, goes to sterilization, goes to sterile storage, and back again. Okay. All right. So again, just trying to share as many free resources with you as I can. You're very welcome, Sherry. You're very welcome. All right, let me get my notes back up. And we're going to get ready to wrap up. If there are questions that you guys have about anything about that test, any sterile processing concepts you're struggling with, now's the time. The Ready, Set, Sterilize series is going on for 2 more weeks after this. So for 2 more Mondays, I'll be here at 4:45 till 6 with y'all, just reviewing everything that's on the exam and answering any questions that you have. Okay, so that's where you can find some game materials to study with. Because I feel like, I don't know about y'all, I know everybody learns differently. But for me, flashcards were very helpful. Also, being able to listen to somebody talk about their process makes it easier for me to start to recognize key terms. So take advantage of all these free, there's sterile processing podcasts out there. Take advantage of all the free stuff. Okay. Let's see. You're not doing a breakout class. Flashcard demos, we talked about that. You build your flashcards as you go. Practice them a little bit every day, and if you can, have somebody else quiz you on them. All right. Let's see a quick test. What was the most difficult section on the test? Okay. So Fran said, what was the most difficult section on the test? And I'm gonna give you an answer you're not really gonna like. That's on you. I can't answer that. So let me be very transparent. I worked on the floor as an entry-level technician for 5 years before I bought the books and self-studied and took the exam. Okay. So for me, the test wasn't as difficult as it may be for y'all. So it would be really unfair for me to try to say decontam is the hardest part or sterilization is the hardest part, that so on and so forth. Now, here's what I'll say as a former sterile processing manager and somebody that has watched a lot of people take this test. What I find really trips people up sometimes is the vocabulary, which is why I keep pushing flashcard. And then knowing these systems, knowing things like the sterile processing workflow, the clean through dirty workflow, the sterilizing workflow, the Spalding classifications of non-critical, semi-critical, critical. When you look at any area that's outlined on the test, so like for instance, let's say you're taking the HSPA or the CBSPD exam, if you go onto their websites right now, they're going to give you information about what's on the test, and they're going to tell you what percentage or weight each section holds. And what you will find is when it comes to assembly, decontam, and sterilization, it's about even weight. Okay? So that's why I say again, if you know the vocabulary of what you're doing and you understand the basic workflow of instruments, this really should not be a challenging, like so challenging the heart of a test that you cannot pass. Now, the last thing I want to say about that is this. When I took my test, I had been in the field for 5 years. I took my test with 5 other technicians that had been in the field. One of them had been in the field the same amount of time as me. One of them had been in the field a year longer than me. And one of them had been in the field for almost 10 years longer than me. And that was the top 3. They had been doing this. One of the ladies that had more than 10 years of experience failed that test twice before she passed it. Now, what did that tell me? Vocabulary. Because here's a lady that is doing this job every single day. She clearly knows how to do this job every single day, but she didn't recognize the answers to that exam. Why? Because she didn't study that vocabulary, in my opinion, the way that would have benefited her. Okay? So that's my test soapbox. Okay, another question says, thank you. Does the test include instrument identification? Yes. It is going to include some level of instrument identification. And if you're taking the CBSPD exam, it may include a little bit more than the CRCST exam. If you join late, one of the things I said I would recommend you guys do for your surgical instruments is for all the basics, the scissors, rongeurs, bone punches, retractors, all the big basic instruments in that section. I would draw me a little something to help me recognize it. But more importantly, on the back of that flashcard, you need to know how you inspect that instrument for cleanliness and workability. You need to know how you take care of that instrument. And you need to know what to do if that instrument is not in working order or it's not clean. Okay? Because they're going to ask you questions about that. They're going to ask you how you test your scissors. They're going to ask you how you check your lock boxes. You know, so like if you're reading through, like for instance, right now, if I say lock box and y'all don't know what I'm talking about, go back to that surgical instrument section and hang out a minute before you take that test. Okay? It's going to be the vocab every time that's going to get you through. All right. So we have gone through my notes that I had prepared for y'all today, but we still have 15 minutes. So did y'all have any other? Because I've seen some great questions over here on TikTok. And I also want to thank my folks over on YouTube for being active in the session today. The Ready, Set, Sterilize series for Study Hall has 2 more Mondays to go. So what I suggest for anybody that has done the Hillman Talk class or is actively doing the Hillman Talk class, YouTube is go over there and look for the Candray Institute. If you're over here on YouTube, or excuse me, if you're over there on TikTok, if you click the link in the bio, it should help you get where you need to go, because that'll take you out to the website. And on the website, you can find my Facebook, you can find my YouTube, you can find, and you already found my TikTok. Okay. I would highly suggest you follow it, subscribe to the YouTube. Anytime I go live, it'll give you a notification. All of the reruns of the free CRCST class are still up on YouTube. Everybody, all my business advisors is telling me that I'm tripping for that. They like, Alessandra, you gotta take it down. You gotta take it down. I will, I swear. I will. I think after the Study Hall series, I'll take it down. All right. Sherry said, what do you do when there's no numbers on the instrument and Google search cannot ID the instrument or one source doc? Okay, so Sherry is on the floor. All right. So for those of y'all that are not as advanced as Sherry, let me explain what Sherry is asking, and then Sherry, I'm gonna give you an answer. Okay. Okay. So Sherry said, what do you do when there's no numbers on the instrument? And what Sherry is talking about is that when you guys become techs and you get on the floor, not only are you going to have to visually be able to recognize these instruments, like if I hold up a Met scissor or I hold up a Kerrison rongeur, you should be able to tell me that's a Metz or that's a, and you will get there. I also want to be clear, when you're coming into the field, nobody expects for y'all to know all that instrumentation off top of y'all head. We absolutely expect to train y'all on instrument trays, and we absolutely expect for it to take at least a full year before y'all can just be like, doop, 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 doop. I'm throwing trays everywhere. Okay, now all that being said, you're a technician. You have a tray sitting in front of you, full of surgical steel instruments. On each one of those instruments is going to be what we call an instrument identification number. It comes from the company. Okay, so let's use my little Aquafina bottle as an example. When I buy this Aquafina bottle, somewhere on here, there's barcode. It belongs to this bottle. If I call Aquafina's distribution center and I tell them I have code number 123456, so this one 121080, they will be able to look back through their tracking system and say that was done on, I'm just gonna make some stuff up, that was done on 323 and delivered to X, Y, and Z, right? It should be able to tell me what this is. It's a bottle of water, it's 16 ounces, X, Y, and Z. Okay, now let's say for whatever reason I'm on the floor and this paper is gone. Now, I know physically looking at it, it's a bottle of water, but I don't know when it was manufactured, and I need that information from how do I get that information, okay? So that's what Sherry's asking. If I can't identify it off the top of my head, I don't know what this bronze jury instrument is. It looks like something I've seen before, but I don't know what it is. And the instrument number is rubbed off. I can't see it no more. What are some things I can do to figure out what this is? The first thing I would say is a Google search, okay? You could type in the instrument name or company name if you know it, right? But the second part of Sherry's question was Google search came up with nothing. I typed it in, I got nothing. I went on one source, I got nothing. Now, again, for those of you outside the field, oh, you're not on, okay, friend. So those of you outside the field, which apparently includes Sherry too, you on top of it, friend. You might not have access to go to one source. One source is it's like a website that keeps all of the instructions for use for surgical instruments and products. And you buy, as a hospital, you buy a subscription to one source, and that allows you to search one source and find IFUs for all these different things that you have in your hospital. Okay. So Sherry was saying, I went on one source too. I couldn't find it. What do I do? Okay. The last thing I would be able to tell you to be able to do in this situation is going to be to contact the manufacturer itself. A lot of times, even if the surgical instrument is missing the number, you'll still be able to tell this is an Askelapp instrument, or this is a Synthes instrument, or this is the Pew instrument, whatever it might be. You can then contact that company and ask for your hospital's rep or representative. Right. So all of these big companies that sell us surgical instruments, they have reps that work for them that I can call in my region and say, hey, Mr. So-and-so that's representing these surgical instruments, I have this thing on my desk. I don't know what it is. I need you to come take a look at it and identify it for me. Or I think it's an XYZ, but I can't find the IFU. I need you to send me the instructions for use, please. Here's my email. Can you send it to me? Okay. Something else with that, if that instrument number is available and you can't find the IFU or something like that, you call that company and say, I have instrument number, I have Aquafina bottle number 121080. How do I clean this? How do I sterilize this? My email address is that. They should be able to get that to you. Okay. So those would be some troubleshooting tips that I would advise for you. Beyond that, baby, I don't know. You might have to tap on somebody's shoulder that's in that department and pray for the best. Now, here's one thing I will say. If you don't know and you can't figure it out, don't you dare put that instrument in a sterilizer and act like you do. I don't want to hear nothing about no Candray Institute student saying, well, I put it in the steam sterilizer because it was stainless steel like them other stainless steel instruments I was. If you don't have instructions for use, you don't have instructions to move. Okay? It's just as simple as that. There's going to be a million times in your career where people are going to challenge you on that. Tell them to call me, and I'll tell them. You don't have instructions for use. You don't have instructions to move. All right? You can't clean, you can't assemble, you can't sterilize because you don't know what to do. All right. Question was, how often do you go live on TikTok? Right now, I'm live on TikTok every Monday at 4:45. If y'all want me more than that, y'all have to tell me, okay? But right now, it's every Monday at 4:45. All right. Any other questions for me? We got about 9 minutes left in this study hall session. Anything else y'all want me to go over? And it really can't be anything. There is no silly question. This is your study hall. All right. Hopefully, y'all making them flashcards. I know Shay is. Shay on top of it. All right. Well, then look, if y'all don't have no other questions, I'm going to give one more study tip, and then I'm going to dip out of here. Beyond you guys studying your flashcards, like I said earlier, utilize some of them free resources like HealthMark or like Sterilize University, HealthMark Academy. We put You can Google these things, guys. Another way for you to find free information to study with is to type into your Google sterile processing CEUs, free CEUs. That's continuing education credits. You'll be able to find some stuff that you can look at. And like I said, it might not all make complete sense to you because you're coming in new, but it gives you an opportunity to see a little bit behind the scenes and just help you build some stronger connections about these sterile processing concepts when it comes to your decontamination or clean room, instrument inspection or assembly room, sterilization room, sterile storage room. Okay. And then lastly, it's not a room unto itself, but we could talk about a little bit is distribution. Okay. So one of the things I know Shay and I talked about last week was with decontamination, distribution. So when we put everything into that storeroom, it's waiting for a surgical patient. They call me and they say, Alessandra, we about to do a lab epi. Okay, I go get my preference card. What's a preference card? Preference card is going to be a list from your operating room with everything that your surgeon wants for that surgical procedure. And when I say everything, I mean everything. How much sterile water they want, how many gauze, gowns, gloves, drapes, surgical instruments, suction tubes, every single thing that they need in order to make that surgical case successful will be on what we call a preference card. And that's a little bit different than your count sheet. What room do y'all use a count sheet in? All right, let me know. Which area of that life cycle of a tray will you use a count sheet and not a preference card? Anybody know? The Okay, now you're going to use your count sheet in assembly and inspection. So what is your count sheet? It's what we call your tray recipe or your set list. Something else I hope y'all picking up. When we're taking this sterile processing exam, they have multiple terms for the same thing. Assembly and prep and pack, same thing. Okay? In the package department, in assembly, in inspection, you're going to use your count sheet because that's when you're going to say, these instruments are clean, these instruments work, and I have everything that this checklist says I'm supposed to need for a major tray or a small bone tray or a lap tray, whatever I'm putting together. There's going to be a list, whether it's a paper copy or it's on screen on the computer, and it's going to say, Alessandra, in order for this to be a minor tray, I need 1 med scissor, 1 Mayo scissor, 6 Kelly clamps, 2 Army Navy retractors, wrap them up, put them in a pack. That's for me. Now, when I'm in assembly and prep and pack, and I'm making that set, and I'm checking that list, and it says 6 Mayo clamps, but I only have 5, I have to go find a replacement because my goal is to make this tray complete. And if I can't find a replacement, That's when I make that note to say this tray is missing a Mayo clamp ×1. And I put that into the sterilizer so that my team, my surgical team upstairs knows when they open it, this minor tray that's supposed to have, it's missing. That's a checklist or a set recipe. Different from a preference card, okay? Now, with the preference card, it might be in the same type of format because it too is a recipe for the entire case cart or the entire procedure, not just the set, okay? So a preference card might have multiple surgical sets on it because maybe the surgeon needs 2 or 3 different types of surgical trays in order to do the whole procedure, and then a list of all those materials that they need, okay? Count sheet in assembly area, correct. Count sheet in assembly. That is where, and you can think about it this way, when you're assembling a tray, I like to think about them like I'm making a cake because then it makes recipe or set list make sense to me. If I'm baking a cake, I got my cake pan, but I don't just have my pan, right? I got the bowls I need to mix my flour and my liquid stuff. I got all this the salt, flour, baking powder, all this stuff out on my counter because that recipe is going to say, Alessandra, you need 2 cups of flour and you need 1 tablespoon of baking powder and you need, right? That's your set list to make that cake. But if I was throwing, let's say I'm throwing a big old birthday party and there's 12 people coming and each one of them got a cake, a preference card would tell me you need 12 cakes for that party. You need 12 minor trays for that procedure. A checklist or a recipe would say, this is how you make the sets that go on that list, okay? Hopefully that makes sense. All right. We got 2 minutes left. Any other questions for me, y'all? If you haven't already, I highly suggest subscribe to the YouTube. You can click the link in the bio to take y'all to the website. If you haven't registered for this series, go over to the website. When you go on the website, there's a big orange button that says register for Ready, Set, Sterilize. I'd appreciate it. It's totally free. Okay? It's totally free. All your registration does is help me show all of my investors that you guys use this and you need this. Okay? So that's something that you can do for me for free after all I have done for you for free today. It's a great way to support. And I do want to say I very much appreciate y'all. This year with y'all has been one of the best years of this company. And so I thoroughly appreciate my TikTok and my YouTube family. All right? Because you ain't got to do nothing. Y'all didn't have to click that screen. Y'all didn't have to click share. Y'all didn't have to subscribe. Y'all do it. And I appreciate it. All right? I hope this helps. I want to see every single one of these students in a sterile processing position. I want to see y'all win. It's a lot of sterile processing jobs, a lot of travel jobs. It's a lot of registry jobs. And even this, hopefully this even shows you guys, there's third-party ways to make businesses and make money in this field. It's not just about being a tech. All right, so you building a strong foundation for yourself and for your community, but also just know the world is your oyster. Not a lot of people know about this. Not a lot of people know how to do this, so we're always in high demand. I would say outside of COVID was the only time in my sterile processing career I had trouble finding work, and that was because all the operating rooms were shut down. And even then, guess what? Even then, I wasn't on unemployment very long because they needed help reprocessing masks. And that was going through that clean and dirty cycle, and they didn't know what to do. They had to call sterile processing manager. Okay. All right. Okay. So I put them free things up on the screen. If you're over on YouTube, you see them. If not, head over to Google. You're going to type in free CEUs for sterile processing. You're going to type in Sterile University, or you're going to type in Health Mark Academy, and those will be available to you. All right. I had absolute pleasure running my mouth about all things sterile processing with y'all for the last hour. If you need me on the in-between, you can reach me at candray.institute@gmail.com. I will drop that in the chat, so it will be on the screen. You're more than welcome to send me an email at any time. If you need help with any type of anything, really, y'all. You need help answering a question on the test. You looking at a concept and you like, I see it says Spalding classification, but I don't understand what they're telling me. Just put the email out, okay? And I'll make a video for it. All right. That's that. I won't hold y'all. I will see you next Monday. Don't forget, all of the live reruns of the class and of the study hall series are still available on the YouTube. So head over there, like those, comment on those, share those. It is greatly appreciated on my end. Y'all have a beautiful Monday and enjoy the rest of your day. All right. I can't wait to call y'all CRCSTs. Woo!